And we are live. Let me get the link out so people can watch us.
Do we want to put up our, photogenic pictures?
Well, I was eating. That's the only reason I did.
Well,
this is an 18-plus room, so language is not an issue. But, again, you know the rules for this. So we have the link up. We are ready for that. And now it's time for the questions. Let's do this. Like I said, we're going to do this for about an hour. We're going to at least get to 100 questions. We're starting with respiratory today. So, respiratory questions. We are presenting live, so it should be locked on my screen. So let's go ahead and give this a shot. All right, back and forth. So, Jeff, you're our lucky number 1. During the insertion of a rigid scope for bronchoscopy, a client experiences a vasovagal response. The nurse should expect what?
Vagal response would be a drop in the client's heart rate.
Yes. Vasovagal may be caused by stimulating the pharynx, which in turn may cause stimulation of the vagus nerve. All right, Christy. That was a nice, easy one to start us off with. A client with right lower lobe pneumonia has ordered chest percussion and postural drainage. Performing percussion and drainage, the nurse should position the client.
Is it 1?
It is not 1.
Four?
It is 3.
Really?
The aim of percussion and drainage is to mobilize pulmonary secretions. In right lower lobe bronchopneumonia, the nurse should position the client with the right side up or lower lobes elevated above the lower lobes. This position would employ gravity in mobilizing pulmonary secretions. Semi-Fowler's position of being bent would hamper mobilization of secretions.
Oh, nice.
All right, Christy, you got it wrong. Get another one.
Okay.
Client with AIDS develops pneumocystis pneumonia. Which nursing diagnosis has the highest priority for this client?
1.
Impaired gas exchange. Can you guys see this? Do you want me to zoom in just a little bit?
No, I can see it.
I can see it.
Okay, I just want to make sure.
Even with my special eyes.
Your special eyes. Impaired gas exchange. That's right. All right. Jeff. A client has chronic bronchitis. The nurse is teaching him breathing exercises. Which instruction should the nurse include in the teaching?
Use diaphragmatic breathing.
Yes, the diaphragm is flat and weak in chronic bronchitis. Breathing helps to strengthen the diaphragm, maximizes ventilation. If you guys want me to go through any of the other ones, let me know. Christy, kind of hard to read this, but let me zoom this in just a little bit so it's easier to read. Client comes to the ER with status asthmaticus. Based on the documentation below, they suspect the client has what abnormality?
Three.
Respiratory acidosis. Yes. Because the partial, yeah, it's respiratory acidosis. That was a nice one.
Do me a favor.
Mm-hmm.
Read the rationale behind that. And I understand the CO2 is 80, and that's twice the normal value, but the pH is
pH is off on that one.
Is actually alkalotic unless that's been written in there wrong.
I have a feeling it's supposed to be written there wrong. Let me see what it says. Because I just noticed the pH is 7.6. That doesn't make sense. C5.
Yeah,
because the partial pressure of arterial carbon dioxide is high at 80, and the bicarb is normal. The client has respiratory acidosis. The pH is less than 7.35. So that is a mistype on this question.
Okay.
Probably supposed to be 7.6 or 7.3.
Yeah, I bet that's supposed to be 7.3.
Okay. That's all. I was just checking because, like I said,
the
pH is alkalotic. And so
equals 7.3. We'll make sure there. I fixed it.
Good, okay. I just didn't want people to get confused about that at a later time.
Absolutely, yes. Thank you for pointing that out. I just noticed that as well. I was like, that's the wrong PA. So, let's go ahead and move that one. Jeff, a client experiences acute respiratory failure, which will most likely demonstrate
Number 4, hypercapnia, hypoventilation, and hypoxemia.
yes, marked by hypercapnia, hypoventilation, hypoxemia. Yep. Jeff's been brushing up on respiratory or something.
No, I just am trying to do better than I did when we actually had respiratory in school.
It's okay, Jeff. It's not like you're a respiratory therapist or
Right.
Christy, a client returns to the clinic 48 hours after receiving Mantow skin test. The area of induration at the injection site measures 18 millimeters. The client hasn't previously had a reaction to this test. The first action is to
3.
no. First.
Oh, first. Oh gosh. Mask.
Mask. Client with initial positive to the Mantow is high risk for active TB.
So we're going to mask them,
Room.
move them to a room, then X-ray them.
Yeah, before you take them to another room, such as X-ray, you should be fitted with a mask. All right.
Words, keywords.
Keywords must know. That's all right. Jeff, a client with ARDS intubated and placed on mechanical ventilation. His partial pressure of oxygen is 60 on a 100% fraction of inspired oxygen. To increase his PaO2 without raising the FiO2, the client will most likely be placed on.
Okay, one of the things you need to know here is he's already on 100%, so you actually cannot increase their FiO2. Just to read that in there.
Okay.
But anyway, what you want to do with one of these people is you want to put them on some positive end expiratory pressure.
That's right. During mechanical ventilation, it improves gas exchange over the alveolar capillary membrane. Time or valve is less effective. All right, Christy. A client with clinically active pulmonary TB is ordered isoniazid, rifampin, pyrazinamide, and ethambutol. Which findings best indicates effectiveness of the drug therapy?
Is it 4?
It is 4. Change in culture from positive to negative is best indication of the antitubercular meds. Cavities aren't a reliable indicator of drug effectiveness. And TB skin tests don't convert from positive to negative.
Nope, you're a chest X-ray forever. I can vouch for that.
Yeah.
All right. Jeff, following a pneumothorax, a client receives a chest tube attached to a 3-chamber chest drainage system. During the night, the client becomes disoriented, gets out of bed, and steps on the drainage device, causing it to crack open and lose its seal. The nurse should immediately
You want to do number 4, place the end of a chest tube in a container of sterile water.
That's right. When the chest drainage system opens, the closed system between the space and device is broken.
We've seen that question before.
All right. Christy, a client was admitted to the ICU 36 hours ago following extensive pulmonary trauma. Its clinical manifestation would first alert the nurse the client is experiencing ARDS.
Three.
There you go. Adult respiratory syndrome develops within 24 to 48 hours following a catastrophic event with no pulmonary disease previously. Tachypnea and dyspnea are your first clinical manifestation of ARDS. Hey, Christy.
Yes.
What's it called if you have a neonate with RDS?
Oh gosh.
Nerds.
Oh my.
Jeff. A client with a history of asthma presents in the physician's office with complaints of difficulty breathing. While performing the initial assessment, the nurse becomes concerned that the client's respiratory status has worsened based on what following information. Go ahead.
Do what? What were you going to
No,
say?
I was about to say where I can catch it. I'm going to try and add our test taking strategies. This is one where you can catch it.
All right. Well, anyway, the complaints of difficulty breathing on initial assessment. The nurse becomes concerned the client's respiratory has worsens based on. Well, just based on what I know, wheezing on expiration only is not right. Mild wheezing on inspiration is also not right. Wheezing throughout the lung fields is of a great concern, but if you have noticeably diminished breath sounds, then that is the worst indication because you're not moving any air if you have diminished sounds.
You got it. And for your test-taking strategy for this one, take a look at this. Where's the button? There it is. Wheezing, 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 no wheezing.
Okay, well, I'm just
test-taking strategy. No, you're absolutely fine. If you didn't know it, but that's that one of these things is not like the other.
Right. Well, that's a good point. But we were taught that, if you're wheezing, you're still moving air. But if you're not wheezing, then you're not moving any air. If you're wheezing here but not wheezing there, or if your wheezing gets, less and less until you're moving essentially no or very little air, that's worse.
Mm-hmm. You're right.
But I didn't think about that one of these things is not like the others. That's good, though.
But yeah, and that's just one of those things where we probably won't have that issue as much with respiratory, but in case you don't, you can look for the little two of these may be right, or one of these things not. Like, try and find if it's one of those types of questions. All right, Christy, a home health nurse is visiting a client with severe COPD, complaining of increased shortness of air. Client's on home oxygen 2 liters via an oxygen concentrator with a respiratory rate of 23 breaths a minute. The most appropriate nursing action is to what?
Three.
Yes, conduct further assessment. Asthma attacks progress. The client may wheeze during both inspiration and expiration. The significant findings are noticeably diminished breath sounds, which means reduced or absence of moving air. We have to assess further. All right. Jeff. The nurse is admitting a client with TB suspected to the acute care unit. The nurse places the client in airborne precautions until a confirmed diagnosis of active TB can be made. Which of the following tests is a priority to confirm the diagnosis?
Confirmation would be done by sputum culture positive for Mycobacterium tuberculosis.
The most accurate way to diagnose TB is to go find the little bugger. Yes. Sputum culture. All right, Christy. Student health nurse is conducting TB testing. Students who had the purified protein derivative test 48 hours ago have returned to have the results read and documented. Ooh. The nurse determines that the test is positive. Which of the following is present?
3.
Yay, that's right. In duration of 10 milliliters or greater is usually concerned. Recording. Let's see. Jeff, fun one. The nurse is aware that the optimal tidal volume for ventilator weaning is what setting?
Oh my God.
The optimal tidal volume for ventilator weaning is what setting?
This is not something we talked about, but I'm not skimping on any questions now. So
I understand, but that's unfortunately varies from patient to patient.
it does. Remember that. This is based on a weight.
Yeah. Oh, okay. Well, then it'd be 3 mLs per kilogram.
Boom! 3 to 5 mils per kilogram. That's why I got that.
Okay.
You said 3 to 5?
3 to 5 mils per kilogram, yes. That's a good one to know, just in case. So, but don't worry, Christy, you get a fun one. Select all and apply.
Oh, yay.
Client with no history of respiratory disease has a sudden onset of dyspnea, chest pain, and tachycardia. Pulmonary embolism is suspected. The nurse anticipates which set of therapeutic orders to be prescribed for this client. Select all and apply.
Oh, my goodness. One, 4, and 5.
Boom!
No way.
Standard therapeutic interventions for a client with pulmonary embolism include proper positioning, oxygen, and IV analgesics.
Wow.
Semi-Fowler's position is most appropriate because high Fowler's position creates extreme flexion of the hips and slows venous return from the legs. The client has no history of respiratory disease and is not limited to 2 to 3 liters. Therefore, 4 would be appropriate to relieve dyspnea.
Okay, so it was what again? I was writing down the numbers from the previous question.
You're fine. 1, 4, and 5.
Okay.
So semi-Fowler's position, morphine sulfate, 2 milligrams IV, and oxygen at 4 liters. They don't have any history of respiratory issues, so they're not limited to the 2 to 3 liters. All right, that was a good one. All right, Jeff. Client with pulmonary edema is receiving 6 liters of oxygen per nasal cannula. The ABG results are as follows. The nurse anticipates the physician will order which of the following.
Okay, 730, that's acid. CO2 is 50, that's acid. We're hypoxemic. Bicarb is normal, so this is fairly acute. You don't want to add bicarb because bicarb is normal. Change nasal cannula, partial rebreather at 8. Intubate. Client pulmonary edema. Change to face mask at 6 liters. Those are both low flow devices. Partial rebreather. CO2 is already high. So I'm going to say 1.
It is not 1.
No, I would have
But you have to think what you were going with. It's fairly acute. So
Yeah, do what?
Yeah, like you said it was a fairly acute issue.
Yes, it is.
So
CO2 is already high.
So 4.
Okay.
Clients exhibiting respiratory acidosis with severe hypoxemia. Intubation and ventilation are warranted. Changing the oxygen delivery system would not correct the hypoxemia. Changing the oxygen delivery system to partial, even with a slight increase in oxygen, would not correct the severe hypoxia. And rebreather would increase the CO2 further. Adding sodium bicarb, of course, as you saw, was not necessary.
Right.
So the issue there was the hypoxemia. We needed to get the oxygen in.
Well, actually, what we would do nowadays is we'd put them on a BiPAP.
Well, we don't have that.
I know, but yeah. But that's current. That's the current mode of therapy for nowadays. Is you go to a BiPAP.
Mm-hmm.
But anyway, okay.
Chris, see, Jeff, you got that one wrong. Get another one. On RN is planning the schedule for the day. Which of the following nursing tasks may the nurse delegate to the LPN?
I'm going to say they could administer the purified protein derivative to a client.
PPD! Got it. All right. Christy, fill in the blank. The nurse assesses a Mantow test to be positive if the induration is 10 millimeters or more when read at what time frame?
48 hours.
48 to 72 hours. Ooh, baby. Jeff, the nurse has just received orders to provide chest physiotherapy for a client 2 times per day. This evaluates which schedule to be most therapeutic.
Jeez. Holy cow. Twice a day. Well, seeing how only one of them is 12 hours apart, let's say 8 a.m. and 8 p.m.
No, that's what I thought it is. Not 8 a.m. and 8 p.m.
That's what I
Okay.
thought.
Most therapeutic. Well, well, let's do it before breakfast then. Let's do it at 7 a.m. and 1 p.m.
The answer is actually 2.
Jeez.
Chest physiotherapy and postural drainage are most effective upon first awakening and during the day, 1 hour before or 2 to 3 hours after meals. This treatment should always be followed by oral hygiene. All other options are most effective either at or shortly after meals.
That's a really bad question right there.
I don't think we ever talked about that, but it's good to know.
Well, I mean, typically, and that is correct. Whenever you're doing these things, you, especially as regards to eating, you want to do them either before or after they eat, because it doesn't say postural drainage there, but if you actually do postural drainage on somebody who has just eaten, they are very likely to vomit. And so that's why I chose the one that was an hour after eating. And then, so I said 7 a.m., so that would be before eating, but apparently that's not early enough. I had the right idea, but
the 1 p.m. is too close to lunch.
That's just, well, it depends on what time you get your lunch tray. Where I work, they get their lunch trays about 8, and then again about 11, 11:30. So
they get their lunch trays at 8?
No, I mean, sorry, breakfast trays. They don't get their their breakfast trays until almost 8 a.m. So,
well, again, that's it's a harsh question, but
yeah, that's, at least I was thinking about it in the
you had the right idea in your head. That's all.
But it was just a guess because you have no idea what, it depends on what time they're going to get their trays.
Mm-hmm. All right, Jeff, the nurse assesses fluctuation in the water seal chamber of a client closed chest drainage system. The nurse evaluates this finding as indicating
fluctuations in the water seal chamber.
Titling.
Yes. The nurse evaluates this finding as it is functioning properly, because you want titling as long as you still have a problem.
Yep. If there is not titling, it may mean there's a leak, or it's back to normal. All right, Christy. The nurse assesses a college-age client complaining of shortness of breath after jogging and tightness in his chest. Upon further questioning, the client denies a sore throat, fever, or productive cough. The nurse notifies the physician this client's clinical manifestations are most likely related to
Four.
some asthma. We got some yummy asthma, exercise-induced. All right, Jeff, this is a hard one. You ready? It's the following is a priority to include instructions given to a client who has bronchitis.
It's too bad Duh is not here. Which of the following is a priority? So let's avoid some cigarette smoking.
Avoid the cigarette smoking. You got it. All right. Christy, the nurse is assessing the respiratory status of a client following a thoracentesis, which finding would indicate further assessment is needed.
Three.
Look at that. The nurse assesses breath sounds, vital signs. The nurse is particularly looking for signs that may indicate a pneumo as a complication from the procedure. Jeff, the nurse is admitting a client who complains of fever, chills, chest pain, and dyspnea. They have a heart rate of 110, respiratory rate of 28, non-productive hacking cough. Chest x-ray confirms a left lower lobe pneumonia. Upon auscultation of the left lower lobe, the nurse documents which of the following breath sounds.
Well, it can actually be several things, but I'm going to say absent breath sounds.
It is not absent.
Okay. Well, Then let's go with bronchiovesicular.
It's bronchial. In the presence of pneumonia, there will be a bronchial breath sounds over the areas of consolidation. The client may also have crackles in the affected side as a result of fluid. As you were saying, there's more sounds.
Yeah,
Absence of breath sounds is not usual. It would not likely occur unless there is a serious complication.
yeah, well, let's see. Yeah, but there again, yeah, that's another one of those things that's kind of, well, it's patient dependent, unfortunately, and I understand, that there are what they consider to be normal findings with certain conditions, but you could hear, like it said, even rails, or I believe that it said crackles, but you can hear rhonchi, you can hear wheezes with pneumonia. You can hear no breath sounds if it's a consolidation, but it doesn't say a consolidation, so I shouldn't have said absent.
All right, Jeff. Just another one. The nurse is preparing a client with empyema for a thoracentesis. Which of the following should the nurse have available in the event the procedure is ineffective?
You should have available a chest tube insertion kit.
Yup. With empyema, the fluid to be removed from the pleural space is thick and pus-like, purulent. The physician may not be able to withdraw the fluid through needle aspiration. The client may require placement of a chest tube to drain the purulent effusion. A ventilator, intubation tray, or crash cart is not likely to be necessary. We're doing good with this, guys. Christy, the client's admitted to a burn unit with second and third degree burns over 18% of the body. An inhalation injury is also suspected. The nurse should monitor which of the following to determine the extent of carbon monoxide poisoning.
3.
Ooh, carboxyhemoglobin levels, right? Wait, no. It's
I said 3. Is it 4?
It is 4.
Sorry.
Carbon monoxide binds tightly to hemoglobin to form carboxyhemoglobin.
All right.
I gave the answer away when you said the wrong answer.
That's
yes,
okay.
serum carboxyhemoglobin. Didn't we have this question the other day, Jeff?
We've had the question before, but I don't recall when it was. But that is definitely, it's a separate. It can be done in conjunction with a blood gas. It depends upon the machine you're using. But a carboxyhemoglobin will measure directly the amount of carbon monoxide combined with hemoglobin versus your regular oxygen saturation that comes with your regular blood gas. So anytime it's a smoke inhalation kind of thing, that carboxyhemoglobin is your measurement.
Gotcha. Good to know. All right, Christy, you got that wrong. Another one for you. Which of the following should the nurse include when suctioning a client's trach?
Oh, gosh. I know we just talked about this at lunch the other day, but is it 2?
It is 2. Proper suction involves inserting the catheter gently until a cough reflex is stimulated or resistance is felt. It is then withdrawn with intermittent suction and rotating motion using 80 to 120 moderate suction pressure. Jeff, the nurse is evaluating the respiratory system of a client who admits to smoking half a pack per day for the past half a pack per day for the last 5 years and 1 pack per day for 10 years prior to that. When evaluating the client's risk of developing respiratory disease, the nurse calculates the client has a smoking history of how many packs over the years.
Lord. Well, a pack a day for 10 years is 10 pack years. And since it's over that, and it's what, a half a pack after that? That's 2.5. So it should be 12.5 pack years.
Boom! Tough actin, inactive. You got it.
Okay, wait. Let's see.
The number is recorded as half a pack times 5 years, plus 1 pack for 10 years.
Okay.
And that's 52.5 plus 100.
I'm sorry, that calculation is just as simple as you think it is, or as it reads. If it had said 2 packs per day for 10 years and then the half, it would be 22 and a half.
Okay.
It's however many packs a day times the years, and that's just how we were taught to do it in respiratory school.
Okay.
30 years ago. I'm surprised they haven't changed it in some way, but anyway, it's really not that hard, or it shouldn't be.
All right, Christy. The client with pneumonia has a poor appetite, is dyspneic, and complains of decreased taste sensation, receiving chest physiotherapy treatments and breathing treatments. Which of the following actions should the nurse include to improve the client's appetite?
One.
It is 1. Because of the sputum production and expectoration, particularly during and after treatments, the client will have decreased sensation. Provide oral care after pulmonary treatments before meals will improve the taste and appetite. Fatigue from breathing activity will also decrease energy. So. All right, Jeff. Oh, we got a duh.
There's old duh. What's up, bro?
He's still logging in.
Oh, okay.
Robert, we are live right now, just so you know. The basic rules of streaming are on. So we are doing our questions. We are all respiratory all day. We're going to go for at least 100. So, all right, Jeff. A client with left-sided heart failure is progressing to pulmonary edema. The nurse assesses the client and reports which of the following manifestations.
Pulmonary edema, bilateral crackles.
Yes. A client with left-sided heart failure and pulmonary edema presents primarily with respiratory symptoms. Because of the fluid accumulation in pulmonary vesicular bed, there may be a productive cough with pink, frothy sputum.
The lady said something yesterday that should make it easier to remember those kinds of things. Left heart failure is lung. Left lung.
Left lung.
Right. If you have left failure, you have fluid backing up in your lung.
Yep.
So left and lung.
Makes sense. All right. All right, Robert. The nurse is performing a respiratory assessment of a client with pleurisy. Compares the assessment findings with the previous day's assessment. Currently, there is no friction rub, but one was auscultated the previous day. The nurse evaluates this finding as a result of
4.
4. Initially, a pleural friction rub is auscultated when there's inflammation. With increasing inflammation, fluid accumulates between the 2 layers at the inflamed site and reduces the friction. All right, Christy. The nurse is caring for a client following a cardiac bypass surgery. The nurse notes that in the first hour, the chest tube drainage measured 90. In the second hour, the drainage dropped to 5. The nurse suspects which of the following.
One.
It may be clotted. Yes, chest tube drainage can be as high as 100 mils an hour, but should taper over several hours. There should not be a sudden, significant drop. Jeff, we got to select all apply for you.
Oh, those are my favorite.
The nurse should monitor a client admitted with suspected diagnosis of pulmonary emphysema, for which of the following clinical manifestations. Select all that apply.
I started to say, is there any other kind of emphysema? But there actually is. There's sub-Q emphysema. But anyway.
Crickly.
So, for which of the following clinical manifestations suspected pulmonary emphysema? Admitted. Well, people with emphysema, if it's just emphysema, and it doesn't say anything here about bronchitis, so they don't normally have a lot of sputum production. People with emphysema don't necessarily have that much wheezing. They typically can't eat because they're short of breath, so they do have weight loss. They don't have a prolonged inspiratory phase, they have a prolonged expiratory phase. They have barrel chest, and they usually are short of breath. So I'm going to say 3, 5, and 6.
You got it. Client's pulmonary emphysema, manifest symptoms of marked weight loss, barrel chest, prolonged expiratory effort, marked dyspnea, and a cough late in the progression of the disease. The scant mucus production, copious sputum production is for chronic bronchitis. Erin, welcome, ma'am. How are you?
Good. How are you?
Good. We are live today, so just letting you know, basic rules of, going on here, no names, etc. We are just going through the questions. So.
Okay.
So, Mr. Robert.
Yes, sir.
The nurse is preparing to delegate which of the following tasks to a licensed practical nurse?
Mm-hmm. Hmm. 4.
There you go. LPN has the knowledge and skill to perform a sputum culture for a client, administering morphine to a client, monitoring a chest tube, or assessing our nursing tasks. Christy! The nurse is reviewing the normal limits for a head and neck assessment, which the following findings would indicate the need for additional investigation.
Two.
The trachea should be midline and the suprasternal notch. It may be normal to feel a small, discrete, movable lymph node. It is clinically insignificant. The thyroid gland should not be visible or palpable, and the muscles should be symmetrical. Erin! The nurse is performing an assessment of the thorax and lungs on a 30-year-old client. Which of the following assessments does the nurse evaluate to be normal adult findings?
Four.
It is 4. Look at you. You guys are rocking this. The thorax is generally slightly elliptical in shape, and although the barrel-shaped chest may be normal in the infant and older adult, costal angle should be less than 90 during exhalation at rest. Jeff. The nurse correctly documents moist, low-pitched gurgling breath sounds as...
Holy cow. Well, let's say coarse crackles.
You got it. That was a good guess on that one.
Well, all the things have changed since I went to school 30 years ago. You know, they don't call stuff the same stuff that we used to, so it's kind of hard for me to think of them in these terms.
Understandable. All right, let's see.
Old habits die hard. That's what I'm trying to say.
Old habits do die hard. All right. Robert, when preparing a client to collect a sputum specimen, it would be essential for the nurse to explain which of the following aspects of the procedure.
Yeah. Shoot. 1.
It is not 1. Mouth care should be offered prior to collecting any sputum specimen.
So you just like swish and spit.
That's still, you don't avoid it though.
Too.
Remember, you want to get the deep stuff.
You don't collect before bedtime.
And if you cough it up out of your mouth, that's wrong.
How about 2?
It is 2. Breathing deeply should be followed by coughing up of sputum. Mouth care should be offered prior to collecting a sputum specimen. The specimen should be collected in the morning, and fluids encouraged before coughing up the specimen. All right, Robert, you got that one wrong. Get another one.
Yay.
34-year-old female client who is para-2, gravida 1, is prescribed the narcotic antitussive hydrocodone. Which information should the nurse discuss with the client?
What's it say? How about 4?
It is not 4.
Maybe after.
Whoa, 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 whoa. 41. It is 4.
I was going to say, I think that.
Sorry about that. For some reason, I highlighted as the wrong answer. I was like, that's wrong. That totally is 4. Yes.
Because after that, it was going to be a real stretch for me.
Yes. This medication is narcotic, and because it's 34 and has at least 1 child, the nurse should discuss proper storage of it. I apologize. I don't know why I did that.
At least I was hoping it was 4 because that's the one I was choosing.
Apologize. You got that right. Yay.
Way to go.
All right, Christy. The client with asthma asked the nurse, why should I... Oh, let me move this over a little bit so we can read it all. Why should I use the steroid inhaler instead of prednisone? Which statement by the nurse is most appropriate?
Hmm. Three?
It is 3. The steroid inhaler does not cause a systemic problem of suppression of the adrenal gland and exposure of cells of the body to excess cortisol. The inhaler delivers anti-inflammatory medications to the lungs where effects are desired. Aaron, pediatric clinic nurse is assessing the routine medication for a child with cystic fibrosis. Which medication should the nurse question?
Four?
It is not 4.
I don't know. 1?
It's not 1. The answer is 3.
Oh, because
We're looking at routine medications.
Is it because they need to cough that up?
Correct.
We're looking. Yes.
Okay.
And Tesla Pearls doesn't that? I mean, it's basically it basically numbs or paralyzes the trachea, doesn't it?
The antitussive medication would suppress the cough reflex, which would result in a stasis of thick, tenacious secretions remaining in the lung and predispose the child and possibly respiratory failure. The nurse would question this medication.
And 4 is used to get the stuff up?
Pulmozyme actually is a drug that breaks
Breaks
down
it up.
protein bonds in sputum or mucus and thereby making it thinner, which helps them cough it up.
We don't want to give them something to stop the cough.
Gotcha.
All right, we're doing so. Aaron, another one for you, Aaron. Client diagnosed with TB is administered rifampin, an antitubercular medication. Which information should the nurse discuss with the client?
Two.
We got that nice orange color. Yep. All right, Jeff. The client is having an acute exacerbation of asthma. Healthcare provider has prescribed epinephrine sub-Q. Which intervention should the nurse implement when administering this medication?
You want to administer the medication using a tuberculin syringe, I believe.
That's right. Very, very low dose, 0.2 to 1 for an adult. The dose is sympathomimetic, must be carefully monitored to prevent tachycardia, decrease or increase blood pressure, nausea, headache, or other central nervous issues.
That way it'll go in sub-Q also.
Easier to dose and easier to put it where you want it.
And I actually just looked up Tessalon pearls on my drug thing here, and it is an anesthetic, and that's precisely why you don't want to give it up.
Good to know. Good to know. All right, Robert. The nurse is preparing to administer the following meds. Which client should the nurse question administering the medication? Time for meds.
40. 15 seconds. It's kind of high. 45, 45. I think. See, the white blood cell count is high, so you're trying to find an infection, so an antibiotic would help. The corticoid is going to make your that go up, but I think PTT is supposed to be 35 to 45, right? So I'm going to say the heparin.
Nope, that's totally fine because you're taking heparin.
This is actually, unfortunately, a question, I believe, in which if you're not familiar with respiratory drugs, you wouldn't get this right.
Correct.
The reason for it is cromolyn is a powdered inhaler.
It's for maintenance only.
It's a maintenance drug, not for asthma.
Mm-hmm.
It can actually make your asthma worse.
Aha!
Well,
You should be getting.
It is a respiratory drug, though.
Mm-hmm. But again, like you said, it's for maintenance only, not for the acute asthma attack.
And that's one of those things that if you just don't know, you just don't know.
And now you know. All right. Let's see. All right, Robert, another one. The nurse is discussing health promotion activities with the client diagnosed with COPD. What information should the nurse discuss with the client?
This is a deep vaccine. Hard time breathing. How about one?
It is not one because it's supposed to be taken annually, not semi-annually.
Let's see. No idea.
Got to give it a guess.
Three.
It is 3. Pneumococcal vaccine titers persist for most adults for 5 years. The vaccine protects against pneumonia, and clients with COPD should receive it to prevent lung infections. All right, Robert. The nurse and unlicensed assistant are caring for a client diagnosed with COPD. Which action by the unlicensed assistant warrants immediate intervention by the nurse?
What warrants immediate action? Is it 1 or 3? Well, I'm going to say, since you shouldn't automatically do it, 3.
Correct. Remember, they got COPD. They should be relegated down to 2 to prevent respiratory failure.
Yay!
All right, Christy. Client with active TB is prescribed antitubercular meds. Which intervention should the public health nurse implement?
4.
It is 4. Communicable disease, detriment to the community, therefore the client is mandated to take the medications and will be observed daily for the duration of the regimen, which can be up to a year. They, of course, cannot drink alcohol. Aaron, halfway through it, which statement by the nurse best describes the scientific rationale for how a non-narcotic medication works on the body?
Four?
It's not 4.
Mm. Mm. 3?
It's not 3. The answer is 2. Non-narcotic antitussives reduce the cough reflex at its source by anesthetizing the stretch receptors. And this is what Jeff was just talking about. Lungs, pleura by decreasing activity.
Can you make that smaller? Because there's a word missing from there, isn't there?
Oh,
Non-tussive. That word see, was missing, and which was bothering me.
yep, yeah, I apologize. Well,
No, it's okay. It's just that without that word there, I was trying to figure out how this applied to respiratory.
Yeah.
yeah.
Well,
let me just do that one.
yeah.
There we go. Is that better?
I can't blame it on that word.
Oh, okay. Yeah, that is better. I was going to say, because the word's still missing, but I see it's on the next line now. I just...
You're good. You're good. Aaron, we'll do a different one for you.
Okay.
Client with an acute exacerbation of asthma is being treated with asthma medications, which assessment data indicates the medication is effective. Select all that apply.
2, 3, 4, and 5.
2, 3, and 5. Clubbing does not occur with clients diagnosed with asthma. It occurs with chronic hypoxia with COPD.
Okay.
All right, Aaron, another one.
All right.
The child with CF is taking high-dose IV antibiotic therapy, cephalosporin, and is being progressively worse. Which medication should the intensive care nurse anticipate being added to the medication regimen?
Mm.
Ooh, this is a good one. I think you realize we're in the medication section now, by the way.
2,
It is not 2.
4.
It is not 4. The answer is 1. Steroids are prescribed when pulmonary symptoms are unresponsive to antibiotics to help decrease the inflammation in the lungs.
Okay.
The client, they'll be doing inhaled mucolytic therapy.
What?
They'll be doing an inhaled mucolytic therapy.
Oh, okay.
That's why we're doing it. That's why we're doing it. Aaron, the client with TB is prescribed isonazid, which diet selection indicates the client needs more teaching. Oh! Diet time.
Oh, man.
You can't drink alcohol, right? So it did 2? Or I don't know.
It's not 2.
Really?
Okay.
You got to be careful with this one.
I'm going to go with the fish.
It is the fish. They can have red wine, not beer. So tuna foods with yeast, tuna foods with yeast, aged cheese, red wine, soy sauce, tyramine, and histamine foods will interact with INH, resulting in a headache, flushing, hypotension, diaphoresis, palpitations.
So it's kind of like the MAOI?
Kind of. Mm-hmm.
Okay.
Sorry.
Yeah, red wine causes an issue, not light beer with isoniazid.
I had no idea.
Which is why they kind of stick with the whole idea. Anti-tuberculin drugs just don't have alcohol, period. But that's kind of a hardy one. Hey, Jeff, will you do me a quick favor?
Yeah, buddy.
Look up the, oh, never mind. It's an anti-tuberculin. Never mind, I'm dumb.
I don't know what you want me to look up. INA?
Yeah, just look it up real quick, see if there's another method of action. But
No, that's it.
okay. All right, Jeff, the client's ABG result. Oh, Jeff, I'm skipping you. This is easy for you. Robert, the client's ABG results are
That's the
this.
last one, so, but okay.
Whoa,
Which intervention is most appropriate for this client, Robert? We'll come back to you, Jeff.
that's fine. 748 more alkaline with an O2 of 30, so acid. With our lungs. Lungs. We're going down. So we're getting heavy, getting fast. 2.
Anxiolytic. You got it. It's client's respiratory alkalosis caused by hyperventilating.
That's our drama queen.
Yep. All right, Jeff, we're coming back to you now. 3-year-old is admitted to the ER with an acute episode of laryngeotracheal bronchitis. The healthcare providers prescribed racemic epinephrine nebulized with oxygen. Which intervention should the nurse implement?
Well, racemic epinephrine is not given by injection. It's an inhaled drug, so it ain't one.
I was gonna say it's nebulized, so.
Right, but I'm just saying it's not for injection. It's inhaled.
Mm-hmm.
Antibiotics don't have anything to do with it. Pediatric floor of their admission. Prescribed for with oxygen. Acute episode, laryngeotracheal. I would suggest that we need, which intervention should the nurse implement? I would obtain a culture and sensitivity of the throat.
It is not that. Epinephrine has nothing to do with that.
Well, I know epinephrine doesn't have anything to do with it.
That's what this is specifically asking about. What do we intervene before we give this epi?
The calendar present. Which intervention should the nurse implement? A 3-year-old is. I guess I just read it wrong. All right, let's see. We got a 3-year-old in an ER, acute episode, laryngeotracheal bronchitis. Got a provider presided racemic epinephrine with oxygen. Okay. Intervention should the nurse implement? I guess you would notify the pediatric floor of their admission then.
Yes, it is. They must be hospitalized to monitor for changes after giving it because the epinephrine is only temporary and distress can return.
Well.
It's a hardy one, though. It was a fun one.
I don't like that question.
All right, Jeff. Which intervention should the nurse implement when administering IV fluids to a 2-year-old diagnosed with acute epiglottitis? Select all apply.
Well, you are supposed to label all their fluids with their name. Obtain daily weight and post at the head of the bed. 2-year-old. I don't know about that. I know you don't restrain. Assess the child's IV site. Yeah. Administer IV fluids with a volume control chamber. Yeah. Post the weight at the head of the bed. I don't see what.
Remember, we're in pediatrics.
I know, but wait. I mean, I know you would wait every day, but I don't know if you need to post it. All right, so I'm going to say 1, 4, and 5.
It is 1, 2, 4, and 5.
I figure.
Because it's pediatrics, any amount of IV fluid can change their weight drastically quickly.
Right, and like any other idiot, can't go and look at their weight on the deadgum INO and that weight chart.
Help prevent fluid volume overload, Jeff. Come on.
Yeah, right.
Stupid pediatric.
Yeah,
There's fluid. I'm doing weight.
All right, Jeff. 8-year-old male client diagnosed with asthma is prescribed albuterol. Child tells the nurse that if he's good at the doctor's office, his mom is going to get him a hamburger, French fries, and a cola. Which intervention should you implement?
Oh, man.
Ooh, you love these questions.
I was going to say, this is a bad question because, you know, let's see, going to get a hamburger, French fries, and a cola. Crap.
I know what I would do, but I don't know about.
Yeah, I know what I would do, actually.
In Utopia, you know, it could be a different.
And at Utopia General, I have no idea what you would do here.
Well, Ben, let me give you a little hint. Look at the medication they're taking.
I see what we're taking. And albuterol, you know, will elevate their heart rate. Oh, crap. I guess they shouldn't eat high salt foods, no?
It's not 4. That's very rare with children to have an issue. It's actually 3. So
I know it's
cola. Don't give the caffeine with albuterol.
Oh, 7-Up doesn't have caffeine in it. Crap.
It is Sprite. Yeah, that was, like I said, that was an interesting question.
Cola is cola, but I forgot that 7-Up doesn't have caffeine.
I thought the same thing. Cola's cola, soda's soda. What does it matter?
Yeah.
No, the child should avoid drinking caffeine. Tea, Coke, Cola, coffee.
Well, it makes total sense now that you say it, but
Yeah.
That's what we're here for. All right, Jeff. Fill in the blank, Jeff. The healthcare providers ordered this medication. How much medication would you administer in a 24-hour period?
20 pounds. Crap. That means I got to do math here.
Math time.
20 divided by 2.2 equals. Do I need to round this to the nearest 100th?
You need to just give me your number and I'll let you know.
I'm just kidding. Let's see. 3 milligrams per kilogram. So we got that many kilograms times 3 equals. How much medication? Q6 hours. So that would be times 4 equals. According to this mathematical calculation that I have here, they should, how much medication for 4 hours? It would be 109 milligrams.
You win!
yay!
Crap.
Now Robert gets to select all the reply.
Man. Took me 5 questions to get one right. This is really bad.
It's okay. It took a little bit on those ones. That was some good information. All right, Robert. The nurse is preparing to administer the first dose of aminoglycoside antibiotic to the client. Which intervention should the nurse implement? Select all that apply.
Well, that's a nasty antibiotic. Well, it's the first dose. You can't check the peak and trough. Use the subclavian line. It's a nasty one, so you don't want to put it in peripherally, so probably that. Determine if culture sensitivity was obtained. Maybe. Check the client's identification band. Yes. Teach the client about super infection with that. Oh, yes. So I'm torn. Do I want to get a culture sensitivity?
Select all that apply.
Yeah, I know. I'm going to say culture and sensitivity. So 2, 3, 4, 5.
Oh, 3, 4, and 5. Not 2, 3, 4, and 5.
Well,
Aminoglycoside can be administered peripherally, does not have to be given subclavian. So you got the rest. Culture and sensitivity must be given before you give it, so determine if it was obtained. Check your ID band for allergies, and the nurse should teach about the antibiotic destroying the good flora. All right, Robert, time for a new type of question. The nurse is reading the intradermal positive protein derivative skin test 72 hours after it was administered. What should you document based on this result?
All right.
I take it it's a 5 millimeter welt. If you're 3 or under, it's not significant at all. So I'm going to say 1.
It is not 1. It's not 1 unless they're at risk. We had a question earlier on this, but you were not on time.
Yeah, well, what happens? Then 4.
The answer is 2, not significant. Wheel measuring 5 millimeters or less is considered not significant, and this client is less than 5 millimeter in duration. A wheel of 10 millimeters or greater is significant with normal immunity. Robert, the nurse on a medical unit has a client with adventitious breath sounds, but the nurse is unable to determine the exact nature of the situation. Which multidisciplinary team member should the nurse consult first?
Well, how about 3?
Do we want to call Jeff?
Yeah.
Versus medical
You got adventitious breath sounds.
Yes, it is 3. Get the respiratory therapist.
And I just looked it up. The supra and super infection, the words are interchangeable.
I figured they were the same thing.
Well, I didn't know, so I just looked it up. And then with the TB skin test, 5 is only significant if they are at risk or if they're immunocompromised.
Correct. 10 is the one where they're normal. They have an issue. All right,
Well,
Robert, good
Why
job.
I bring that up is because he said 3.
Yeah, I thought it was 3. I didn't.
Yeah.
That's what he did.
I didn't know either. I looked it up. It's 5.
It was 5, so okay. I'll remember that.
Oh, right. Christy, the nurse is working with the LPN and unlicensed assistant personnel to care for a group of clients, which nursing tasks should not be delegated or assigned.
3.
Mm-hmm. Aaron, which client should the charge nurse assign to the new graduate on the respiratory unit?
Four.
It's not 4. Four is not stable.
That's it.
One.
It's 3.
You would give it to a nurse TB patient?
Yeah, they're stable.
Your medication's working?
Yeah, they're stable. Doesn't matter what they are. They're stable patient. Non-productive cough, orange urine. That's just the medication working. You wouldn't do 4 because they have respiratory compromise. You wouldn't do 1. The client with lung cancer is expected to have rust-colored pitutum. However, complaining of pain at a 10 warrants a more experienced nurse to assess the cause of the pain and medicate as necessary. Looking for stable for the new graduate. Aaron, which tasks are appropriate to assign to the unlicensed assistant? Select all that apply.
1 and 3. I guess 1 and 3.
The answers are 1 and 4. Mouth care. 3 is the housekeeping staff empties the trash can, not the unlicensed assistant. Don't assign tasks that should be done by other hospital departments. And 4 says the assistant can take empty blood bags to the lab.
I didn't know you took blood, any kind of blood, back to the lab at all.
Well, again, that would be more with a reaction.
Okay, whatever.
That was a fun question. We'll do a different one.
Yeah.
Aaron, which client should the medical unit nurse assess first after receiving shift report?
One.
It is 1, yep. Elderly client diagnosed with pneumonia may not present with normal symptoms such as fever. A restlessness may indicate a decrease in oxygen. This is the one where you look for your unstable patients. All right, Jeff, we're back to you. Client's 2-day post-op following a left pneumonectomy has an apical pulse rate of 128 per minute and a blood pressure of 80/50. What intervention should you implement first? Jeff went away, I think. All right.
No, sorry, I didn't go away. I muted because my wife just got home.
You're fine.
I just didn't want to disturb people. All right, let's see. All right, well, you're going to notify the frickin' healthcare provider. Just don't know if you're going to notify them before you look at it. Let's look at it first.
No.
That figures you
The answer is 4.
4?
They started shock.
What about in deficit?
You got to give them fluid
understand
immediately.
I understand that, but I don't. I guess I did. I looked at that as a thing about, I don't know that I have an order for that. So.
Oh, we always have
Well,
an
in
order.
Utopia General.
We always have an order.
That's the reason why I wasn't going to do anything about that. So.
Yeah. Well, as soon as something like that shock happens, you make sure you give them fluid. Remember, we can't go to get some help unless we make sure the patient's safety is taken care of first.
That's why I said assess them first.
Assessing has already been done by looking at the vitals.
Look at you. I hate these questions.
Get used to it because it's the last.
I know, but they just always seem the way to make you think what's right is wrong. It doesn't matter what you choose, and no matter what your rationale.
All right, well, we'll get them again for you, Jeff. The client's 1-day post-op.
Yes, and sometimes you do stuff without an order, and sometimes you don't.
That's the other thing I don't like is sometimes you do have an order, sometimes you don't have an order.
Yeah, I know. That's what I'm saying. If it was consistently applied, it wouldn't bother me.
Uh-huh.
The client's 1-day post-op, Jeff, following chest surgery, having difficulty breathing, bilateral rails, confused and restless. Which intervention should you implement first?
Well, you ain't going to put them on their head if they're having trouble breathing. Let's see. Post-operative chest surgery. See, here again. This is one of those things where... Yeah, well, I was going to say, you're going to do all of these things. Having difficulty breathing. Assess their pulse ox. Got bilateral rails. They're confused and restless. Crap. Which one should you do first, though? But that place them in Trillendellenberg, you're not going to do it all, so.
So what would you do
Difficulty
first in relationship to patient safety?
Safety. I love me some safety. All right. When you already know they're short of breath. Checking that. Mm-hmm. 1 day post-op. I'm going to check their pulse ox while I'm looking at their surgical dressings. What I'm going to do.
Well, so far you're not on the right track.
Yeah. I guess that these goobers are probably going to call a QRS then.
Rapid response.
Shit.
Rapid response is mandated by Joint Commission. Yeah. A code is called if the client's not breathing. You got it, Jeff.
No, I didn't.
You said you gave me a rapid response.
Yeah. Mm-hmm.
All right.
I see that.
I'd have done all that other stuff except the Trendelenburg thing.
Breathing.
Trendelenburg's not done, like you said.
It's the difficulty breathing. It doesn't matter what his pulse ox is. He still has difficulty breathing.
Yeah. All right, Jeff. One more, Jeff. The client.
It may take me 3 or 4 more to get one right.
The PACU has noisy, irregular respirations with a pulse ox of 89%. What intervention should the PACU nurse implement first?
Your computer's still on, Jeff. It hasn't shut off yet. Come on, you can do it.
Yeah, I'm if I miss one more, I'm liable to get a shut.
Hanging in there, buddy.
All right, so they have noisy, irregular respirations. Well, if they have irregular respirations, that's a problem. Jeez.
You're getting the good ones. Now, I told you we'd get harder as we went in.
Well, you would want to open their airway, so I would say 3.
You got it!
Oh,
Hypopharyngeal obstruction. This maneuver pulls the tongue forward and opens the air passage.
I'm surprised that that's right.
That is right.
I know it's right, but I'm surprised this thing thinks it's right.
All right, Robert. It's your turn, hot dog man. Today's surgery commission nurse is obtaining operative permits for clients having surgery. Which client should the nurse question signing the consent form?
Well, somebody who's not in their right mind. So, ectopic pregnancy.
Jeff, you want this question?
Probably okay. Kind of schizophrenic. That's probably not a good choice. Probably alcoholic. Probably in his right mind. Diagnosed with that. I gotta go with the schizophrenic.
There you go. See, Jeff, you could have had that one.
I might have got that one right, yeah.
It's all right. So, again, we're all in respiratory right now.
I might have gotten it right.
Christy, the ICU nurse is caring for a client on a ventilator who is exhibiting respiratory distress. The ventilator's alarms are going off. What intervention should you implement first?
Two.
No.
What?
We had a question just like this. Well, you weren't with us in respiratory.
Then 3.
It is 3. Check your equipment before you deal with the patient.
Sorry you're not breathing there, buddy. Let me check this out.
Now, I'll tell you what it says. On 3, it says the client's having respiratory distress. The alarms are going off. Therefore, the nurse should first assess the ventilator, determine the cause of the problem, and correct it because the client's totally dependent on the ventilator. This is one of the few situations where the nurse would assess the equipment before assessing the client.
Wow.
If the ventilator system malfunctions, the nurse must ventilate the client with manual resuscitation until the problem is resolved. You should determine whether the nurse can remediate the situation by setting the ventilator before your manual. So if the ventilator is just not working, you go to manually bag them after you assess.
All right, read the rationale for 3 again, please.
The client's having respiratory distress and the ventilator is sounding an alarm. Therefore, the nurse should first assess the ventilator, determine the cause of the problem, and correct it because the client's totally dependent on the ventilator for breathing. This is one of the few situations where the nurse would assess the equipment before assessing the client.
Yeah. Is he busting the machine, or is he really having a problem? Or
Yeah, is the machine like, is there a kink, or is there some sort of issue that I can fix really quickly and fix the issue? All right, who just did that one? That's exactly
Christy.
that one. All right, Christy, get another one then. Charge nurse on the critical care respiratory unit is evaluating ABGs. Which client would require immediate intervention by the nurse?
Ooh.
All right.
You can throw two of them out right away.
Three.
Holy, but yep. 3. ABG, so respiratory alkalosis. The nurse should assess the client first, determine if the client is hyperventilating, in pain, or has an elevated temperature. Aaron, we're rocking through these. We're almost done. We're almost 3/4 of the way. Primary nurse in the critical care respiratory unit is very busy. Its nursing task should be the nurse's priority.
Is it 2?
It is air hunger. Indicates respiratory distress. ABCs. All right. Jeff, we're back to you, sir. The nurse is caring for a client diagnosed with flail chest who has had a chest tube for 3 days. The nurse knows there's no titling in the water seal compartment. Which action should the nurse perform?
Check the tubing for dependent loops.
Mm-mm.
No?
Nope. It's been 3 days.
Well, that don't have anything to do with it, to be quite honest with you. Okay, then auscultate the posterior breath sounds.
Yes. After 3 days, you'd expect that the lungs have expanded.
Just
That'd
because
be
you
the first
expect it don't mean that it happened.
I'm just letting you know, after 3-day time limit, it switches from 1 to 2.
That's crap.
But that's what no titling in your water seal compartment is.
Right. So, it could be that, or if it happened early on, there could be a kink. 1 is technically correct if it was earlier than 3 days.
Of course. Go back up there for just a second. Does it say how old they are or anything? No.
No, just
Because,
it just says they've had it for 3 days.
right.
Which one was the answer?
I don't know which one was the answer.
You auscultate to see if they have if their lungs are clear.
Yes, because you think maybe it's been fixed.
Okay.
All right. Jeff, that was close. Client was a right-sided pneumo, had chest tubes inserted 2 hours ago. There's no fluctuation in the water seal chamber of the pleurovac. What should you implement first?
Same stinking question, but the answer is the same. Check for any kinks in the tubing.
Are you sure it's not 1? You don't want to do. Yes, this time it is. Check for kinks in the tubing.
No, just listen to their lungs again.
Because it was just put in.
Oh.
You would do 1 after you've checked for kinks because it's less than 3 days.
That's just so much horse crap.
That's so confusing.
I'm going to fail the stinking respiratory part of the test.
Okay. Good job, Jeff. Good job.
Oh. Yes.
All right. Robert,
Oh my goodness.
which client requires immediate attention of the ICU nurse?
Oh, immediate attention. What's this? Having neck stiffness.
Ooh, I haven't heard that disorder in a while.
And with ARDS who has difficulty breathing. Well, I don't think that's explaining the next difference. We're going to do anything. Someone with ARDS would have difficulty breathing. Pulmonary sarcoidosis. Boy, you hear that on house all the time. Dry, mild chest pain, productive cough, and chest tightness. I'm going to go with 3.
There's a trump card. 2. Difficulty breathing. Doesn't matter the disorder.
Wow, really?
You would expect difficulty breathing. You're right, but that trumps everything when they have difficulty breathing.
Yeah.
All right, Robert. Select all that apply.
The
The client in the ICU is on a vent. Which intervention should the nurse implement? Select all that apply.
On a vent.
We're gonna go till 1 o'clock because that's about 110 or 100, whatever comes first. So.
So you said we're going all day. What happened all day?
No, I didn't. I said we're going up to 100 and then we take our breaks. We are not doing full test mode anymore.
1 true. 2 probably more than that. 3. I have no idea. So everything except 2.
You are right, sir. Everything but 2.
I was gonna say you do that more often than that.
Yeah, read the rationale if you don't mind for 4.
You got it. Ventilator settings should be monitored throughout the shift.
That's it.
That's all it says.
No.
That's it.
That's literally what it says.
Well, the only reason why I'm wondering about that is because of the 4-hour time frame. If you're checking the respiratory status every 2 hours, why are you only checking the ventilator settings every 4 hours?
Well, again, that's just check the vent throughout the shift.
Every time you check your patient.
23 questions to go. We're doing great. We're doing awesome. All right, Christy. The unlicensed assistant is bathing the client diagnosed with ARDS on a ventilator. The bed is in the high position with the opposite side rail elevated. Which action should the ICU nurse take?
Four.
Yes, you did a good job with the bath. Good job.
Let's don't bathe this patient.
All right, Aaron.
Yep.
The female charge nurse in the respiratory unit tells the male, "You are really cute and have a great body. Do you work out?"
What?
Which action should be taken by the male nurse if he thinks he's being sexually harassed?
This is Jeff.
This is so funny.
What do you mean?
What was that?
Hang on.
Where's the take her out on a date?
I don't know, 3?
No, not first.
1? Tell them.
2. Ask them to stop.
Yeah.
Ask them to stop first.
You always have to follow your chain. Start with the issue first, and go up from there if it doesn't fix. The first action is to ask the person to stop directly. You need to be told in clear terms the behavior is inappropriate and uncomfortable.
What did you say about Jenna?
Huh?
Christy.
I'm sorry?
You said this is Jenna.
No, I said Jeff.
Jeff.
Yeah. The deal, hey, listen. The thing there is I've actually, having worked in a hospital, I don't know if they do that. I know you worked in home health and all, but in the hospitals, they make you go through these sexual harassment training things all the time.
Mm-hmm.
And the first thing they always tell you to do is tell the person who is offending you that they are offending you and they need to stop.
Okay.
Mm-hmm.
I didn't know.
Sexual harassment panda is sad. All right, Aaron. Client diagnosed with abdominal pain of unknown etiology has an NG tube draining green bile. Reports abdominal pain of 8. The client's ABGs are as follows. Which intervention should you implement based on the ABGs? This is a really good one to remember.
Is it 3?
It is 3, because we're the ones that usually cause this one. Metabolic alkalosis. We're suctioning out the hydrochloric acid.
Okay.
All right, Jeff. 80. The charge nurse in the ICU asked the nurse to float from the med surge unit to the ICU. Which client should the charge nurse assign to the float nurse?
All right, let's see. All right, well, you don't want them to have 1. You don't want them to have 3.
Yes, you do.
I mean, not 3. I'm looking at the number 3 in this 13 here. 3 is the one you're going to actually give them. You don't want them to have 2 because they got a CVP of 13.
Mm-hmm.
2 is the only one who has basically a stable illness.
3.
I mean 3, the pneumonia one.
Float nurse in the medical unit.
Whatever number the bacterial pneumonia one is, that's the one you want to give them.
Hey,
Yes, they can give antibiotic therapy.
what's the normal central venous pressure?
2.
The CVP is, well, they gave here a 4 to 10, but
Okay.
if it's elevated, it indicates right ventricular failure or overload. All right, Robert. The client has an ABG of this. What intervention should the critical care nurse implement?
We're good except for that O2. Let's give him some O2. 1.
Hey, look at that. Give him some oxygen. Christy. The husband of a client diagnosed with terminal lung cancer asked the nurse, how am I going to take care of my wife when we go home? What action by the nurse is most appropriate?
Oh gosh. One.
Yes. This is one of those ones where you just start throwing out the wrong answer. All right. Aaron. The clinic nurse is scheduling a chest x-ray for a female client who may have pneumonia. Which question is most important for the nurse to ask the client?
Four.
Yes, do you have any chance you might be pregnant? Can harm the fetus. All right, Jeff. The clinic nurse is returning the phone messages from clients. Which message should the nurse return first?
Well, let's go with the old person who gets dizzy when they get up.
That's right. Mm-hmm.
Orthostatic hypotension.
Orthostatic hypotension can be life-threatening. Robert, the client diagnosed with active TB tells the health nurse, I am not going to take any more meds. I'm tired of them. What's the best response? Ooh, this is the Jeff answer.
I guess one.
It's not one.
Really?
You ain't gonna like this answer. You weren't here earlier for this.
If I'm not going to like it, then I wouldn't like two.
It is 2. The clients with active TB must take it for a year. If the client refuses, a court order will be obtained to make them take it in a community threat.
Nice.
All right, Robert. The
Come
nurse
to
is
your
working.
house too.
The nurse is working on an outpatient clinic along with an LPN. Which client should the nurse assign to the LPN?
Three.
That's it. Pretty stable. Major, let's see, acute bronchitis, inflammation of the tubes, major airways in the lungs. The client's exhibiting expected symptoms.
Nothing else. You'll have to give her some Tylenol.
All right, Christy, we're getting there. 13 to go. Unlicensed assistant tells the nurse the male client in room 1 is really breathing hard, can't seem to catch his breath. Which instructions should the nurse give the unlicensed assistant?
Put a pillow on his head.
Three.
Yes. First intervention because the nurse must assess the client. All right, Aaron. Clinic nurse is scheduling a 14-year-old client for a tonsillectomy. Which intervention should the clinic nurse implement?
Four.
Yes. Bleeding is a life-threatening complication. We talked about that yesterday, remember? All right, Jeff. Client calls the clinic nurse and asks, what's the best way to prevent getting influenza? Which statement is the best response?
Number 3.
Pick number 3, my lord. Yep. Get your yearly vaccine. Robert, the clinic nurse is evaluating vitals for a client being seen in the outpatient clinic. Which client would require nursing intervention?
Nursing intervention. All right. Hmm. What about my preeclamptic mom in 3?
There you go. Pregnancy-induced hypertension. It's not preeclamptic. It's pregnancy-induced hypertension. No other symptoms in there.
Preeclamptic.
Yeah. All right, Christy. The nurse is accidentally stuck with a dirty needle used to administer intradermal injection for a PPD. Which intervention should you implement first?
Two.
Yes. Wash that area. All right, Aaron. Clinic nurse is reviewing lab results for clients in the clinic. Which client requires additional assessment by the nurse?
Number 1 is low, but number 3 is worse. The 3?
3's fine.
Oh, 1.
It's like, what's wrong with 4.8?
Sorry. I don't know why I was thinking 3.5 to 4.5. It's 3.5 to 5, right?
Correct.
I don't know. 1.
All right, Aaron, do it again.
Okay.
The Hispanic. Ooh, it's time for culture.
Yay.
Hispanic female diagnosed with bacterial pneumonia is being admitted to the med unit. The Hispanic husband answers questions even though the nurse directly asks the client. Which action should the nurse take?
Three.
3. Allow the husband to answer the questions. Cultural beliefs. All right, Jeff. Clinic nurse encounters a client who does not respond to verbal stimuli and initiates CPR. What should the nurse do? Prioritize the actions from 1 to 5.
Oh, horse crap.
Well, it says you've already, done the first couple, but okay. Anyway, here we go. Let's see. Pinch the nose? No. Perform compressions? No. First thing you do is you shake and shout. So you do number 3 first.
Correct.
Then after you have established unresponsiveness, apparently, you are going to open their airway. Then after you open their airway, you are going... What?
It's not airway first.
What?
Airway's not first.
Oh, crap. I forgot they changed this to
Yep, yeah.
CAB.
Mm-hmm.
All right, crap. I'm glad you said that.
Yeah,
All right.
redo that for me.
Yeah, you still do 3 first.
You do 3 first.
All right, then you check their pulse.
No.
What?
Well, if you don't check their airway or you don't check their pulse next, what do you do next? Because then I don't...
Compressions.
Always start compressions first.
Always start your compressions first.
Oh, Jesus, I'm in trouble.
Well, that's kind of stupid. If they've got a dead-gum heartbeat and they've got a pulse, you shouldn't be doing compressions.
I agree. This one's kind of odd.
Also, let's see, the clinic nurse encounters respond verbally. See, it doesn't say there's anybody else there, so how are you going to do a...
30 to 2 is one person.
Okay, that's right.
Yeah.
Well, anyway.
Yeah, the answer on this one, and this is a bit weird.
Yeah, I was going to say, this whole thing is screwed up, but so you just tell me what the daggum answer is.
The answer on this one is assess
Yeah.
your responsiveness. You had that one. Then it's perform compressions, open the airway, followed by pinching the nose, and then checking the pulse. That's not right. So we're going to kind of get rid of that one.
I was going to say that I'm pretty sure.
That's not the new system. So we'll leave that one alone.
That just, I mean,
That was a bit. That one might have been an old question. So we'll kind of move out of that.
I don't know. All I know is that's not how I would do it. I don't care what the test question says.
All right, Jeff. Home health nurse is visiting the client diagnosed with end-stage COPD with the unlicensed assistant is providing care. Which action by the assistant would warrant intervention by the nurse?
Please hit test.
What do you think, Mr. Jeff? Jeff? Oh, Jeff's gone. Robert, it's yours.
Okay. End stage COPD. Care.
Are we still on me, or what happened? Because I was talking and nobody else was there.
You got DC'd, apparently. Go ahead, Jeff. This is still you.
Okay. Well, anyway, COPD people can't stand the heat, so I'm going to say keeping the bedroom warm.
Correct. They want the cool air with a fan to help them breathe. I don't know what happened there, Jeff, but welcome back.
I don't know either, but I couldn't hear you guys. I was just talking away over here.
Yeah, we didn't hear anything you said. All right, Robert.
That made me feel right at home.
Which task is most appropriate for the home health nurse to delegate to the unlicensed assistants?
Home health nurse. To the unlicensed. Changing and dressing? No. Inserting a catheter? No. Demonstrating ambulation to a walker? No. So I guess 4.
Yes. All right, Christy, 3 to go. Local restaurant. The nurse overhears another hospital staff member talking to a friend about a client. The staff member discloses the client was just diagnosed with lung cancer. What's the most appropriate action by the nurse?
2.
Don't discuss it. Yeah. All right, Aaron. 92-year-old client has a hospital bed in the home and is on strict bed rest. An assistant cares for the client in the morning 5 days a week, which statement indicates the assistant needs additional education by the nurse.
One.
1. Yep, there's nothing saying that she can't have fluids. All right, Jeff. Don't DC on me, Jeff. Don't DC on me.
I'm hanging on, bro.
Okay. The home health is diagnosed with chronic obstructive disease. The unlicensed assistant tells the home health nurse the client has trouble breathing and the client lies in a supine position. Which priority instruction should the nurse provide to the assistant?
Don't lay them in supine position? Yeah, okay. Let's look for the answer then. All right, let's see. Which priority? Well, it doesn't say that they have oxygen, but I would suggest first thing you do is make sure their oxygen is in place correctly.
It is not 1.
Well, that's what you would do, because if they're not wearing their oxygen, then that makes, you know...
Yeah, this is a weird one.
That makes them short of breath.
The answer on this one is 2.
Allow them to sleep in the recliner.
Because the client has difficulty breathing while lying in bed, allowing the client to sit in the recliner will help the client. Therefore, this is your priority.
Well, it doesn't say anything in the question about sleeping.
No, it doesn't. That's why I didn't like that one. So we'll do one more. The wife of a client diagnosed as terminal is concerned the client is not eating or drinking. What is the home health nurse's best response?
Well, I wouldn't say this, but number 4 I think is the right answer.
No, it's not 4.
Really?
That's therapeutic, but not. They're asking you a question.
Yeah, good, because I wouldn't say that.
It's not 4. You're right.
I would say, let's see, which is the wife is a client. She ain't asking a question. Which is
No,
the health nurse's best response?
4 is giving your opinion, so we can't say 4.
Oh, okay. Yeah, I guess so. I was thinking about asking them about their feelings about it, though, you see. Would be the right answer. Not eating or drinking. Well, diagnose. It doesn't say, though, that they're in hospice either. See, that's kind of crappy. The wife of a client diagnosed with terminal cancer, or terminal whatever, doesn't even say that, does it? The wife of a client diagnosed as terminal, not eating or drinking.
I don't like this question.
I don't either. That's crap. I mean, you know, you should discuss placing a peg feeding. That's giving your opinion. I will start an IV if your husband continues to refuse or eat. You can't do that if, you know, depending upon, because you don't know whether or not he's got a living will or not, because it don't say.
Mm-hmm. So what's your answer?
And this is normal end-of-life dehydration produces a type of euphoria. Not eating or drinking. Hell, I don't know. I guess 3.
It is 3.
Even though I don't think that's right. But
No, we actually have a question
I'm
on
not
that. We had a
saying that
question.
it doesn't create a type of euphoria, but anyway, I don't like that question either.
Well, we just did 100. As long as you got 60%, you guys are on track for respiratory.
Well,
Okay, David, I have to run. But
Yeah, but we are ending here for the day. So
are
you're
we
fine.
getting back on at 11 tomorrow?
We should be, yeah. We'll see. Well, it might be a little bit later than 11, but let me jump off. Bye-bye, broadcaster.